Recent research has found that type 1 diabetes is strongly connected to enteroviruses, which are viruses that are commonly found in children. Now, many children will be exposed to this, but not all, of course, develop diabetes. At Wholistic Pediatrics, we haven't seen any of our children develop type 1 diabetes. So it got me thinking, maybe there is a way that we can prevent type 1 diabetes. Let's talk about it. So I've been reading a lot about type 1 diabetes, and I've been really interested, is this something that can be prevented? Because we've been able to see such significant reductions in so many other conditions that affect children. So I first want to talk to you about the difference between type 1 and type 2 diabetes. So type 1 diabetes is inflammation in the pancreas, usually autoimmune, that leads to a reduction or destruction of the cells that make insulin. Type 2 diabetes is typically what more or older people will usually get. And this is where, due to lifestyle, due to exposure to long-term high carbs and sugars, where the body stops reacting to the insulin that is there. So that's more of a problem on the end cellular level as opposed to a pancreas issue. Now, type 1 diabetes itself, it is, as I said, most commonly found in children, and there seems to be two peaks in the age. There's a peak around 4 to 7 years old, but then there's a second peak that happens around 10 to 14 years old. Now, adults can develop type 1 diabetes as well. So it's not just simply as childhood diabetes versus adult diabetes, but it's kind of because of those age differences why it's sometimes referred to as that. Now, not always, though, is type 1 diabetes caused by inflammation and by or autoimmunity. I have type 1 diabetes because, as some may know, I had a pancreatic tumor removed 5 years ago, and with that, they had to take most of my pancreas. With that, I do not have a lot of pancreas to make insulin, so I have an insulin deficiency, but it's mostly because I don't have a pancreas, as opposed to the fact that my pancreas was destroyed. I guess you could say the surgeon destroyed it by taking it out, but not quite the same thing. So, of course, I always talk about preventive health and wondering if there are things that in our holistic approach, because it works so often, that we could be doing. Now, in our practice, we have over the past 20 years had about 2,000 babies born into our practice and probably about the same number of young children who transferred in. So for me, being born into the practice is there within the first couple of months where we're doing the newborn care. An older child, what I mean by that is an older infant into toddlerhood, but people who started with us well before they hit that first peak as to when diabetes would happen. And that, so with that, and the prevalence of type 1 diabetes in the general population for children is about 0.3%. So by our numbers, we should have had about 12 patients, give or take, who would have developed diabetes over this time. Yet, to the best of our knowledge, we haven't had any develop type 1 diabetes. I've had patients transfer into the practice, but not those who were with us from the very beginning. So that really made me wonder what's going on. Now, as I had alluded to a little before, enteroviruses have been strongly related. So these included, there's enterovirus types A, B, and C. Within enterovirus, there's also the family of Coxsackie viruses, and in particular B1 and B4. There are other enteroviruses. Polio is actually an enterovirus, but of course, that's not what we're talking about here. Now, it appears to not only be enteroviruses, because we have also seen that SARS-CoV-2, the coronavirus, does also induce diabetes in some people as well. So, inflammation, overinflammation can trigger autoimmunity. That seems to be what's going on here. So in this case, if there are autoimmune antibodies that are being created that attack the islet cells, these are the cells in the pancreas that make our insulin, then that would eventually lead to the destruction of the pancreas, what leads to the diabetes or an insulin deficiency. Now, short of keeping a child in a plastic bubble, of course, there's no way of avoiding these common childhood illnesses. Now, as we've talked about so often, how much we've seen the minimization of COVID, influenza, many other viruses. And of course, we find that having good vitamin D levels and good zinc levels keep the immune system from overreacting in the first place. our immune support protocol with the high dose vitamin A and the vitamin C and the other things that we do in terms of keeping the inflammation from getting too out of control once a person gets it as well. And so that may very well be why we're seeing it. But I did some additional research on this, because as you'd expect me to do, to see if I could find a more direct connection. And I did find a paper from back in 2018. And this was a study of Italian children. It was done in Italy. And they took 82 patients who had type 1 diabetes, and they matched them with 117 non-diabetic controls. And what they found is that while the non-diabetic controls were consistently negative for antibodies against the enteroviruses, 65% of those with type 1 diabetes had the evidence of these viruses. Now, they then combined it by looking at levels of 25-hydroxy vitamin D, which is the number that we look at when we are trying to, when we are assessing vitamin D sufficiency. And what they did is they actually used, which is the same things that you'll see on lab forms, a level under 20 nanograms per milliliter would be considered a full deficiency. Insufficiency would be under 30, and sufficiency would be considered 30 to 100. As most people know, I've said before, we aim for 50. That seems to be a really good, solid number that nobody could argue is going to be too dangerous to somebody. Now, the diabetic children showed a vitamin D deficiency in 48.8% of the cases, whereas in the non-diabetic controls, it was under 18%, just under. So that is like almost a triple of vitamin D deficiency found in those with type 1 diabetes. Now, furthermore, they found that at the time of the clinical onset, when they would also find the diabetes but also look for the enteroviruses, the enterovirus cases had reduced vitamin D levels compared to the ones that were enterovirus negative. So what does this suggest? This suggests that adolescents and children who have proper levels of vitamin D were able to more rapidly clear the virus and stop the cytokine storm, stop the inflammation from happening. So if these children were faster able to clear the virus, then we should be able to reduce the inflammation and stop these secondary effects from happening. So what is my take-home message? Similar to COVID and long COVID in particular, and other hyperinflammatory and autoimmune conditions, preventive measures seem to be very helpful and beneficial for stopping chronic diseases from happening. And so, of course, we want to get those things optimized, and then we want to hit them hard with their immune protocol in order to stop the hyperinflammation from happening. So I hope that helps you. Please share this with everybody if you know anybody who you think that this would be helpful for. If you haven't subscribed to our channel, of course, please do so. Please join us on our Patreon and be a member there, where we continue to put exclusive content there. And of course, we now have our podcast that we are doing for those who prefer audio information only. Thanks, and have a great day. Please make sure that you subscribe to our channel. We release new content every Tuesday, Thursday, and Sunday.